My name is Lisa Powell. I'm from the School of Public Health, and this is a session on disparities in public health in light of climate change. And I would like to welcome Dr. Victoria Persky to start her presentation. She is a professor in the Division of Epidemiology and Biostatistics in the School of Public Health. And Dr. Persky will be examining health disparities in the United States and exploring for us some of the contributing factors and areas for intervention.
Good afternoon. It's great to see you all. I'll give a very short presentation on overall disparities in public health. Followed by, there'll be 4 other short presentations with more focused examinations. Trying to move this and it isn't moving, which it did before.
Move it on your own screen, I think.
Say that again. I'm trying to. I don't see it. No, something is not working the same way, Jacob. Not sure what the problem is.
Victoria, are you looking at your PowerPoint?
Looking
like the thing on your screen, your PowerPoint. Make sure that you're looking at PowerPoint and not.
Oh, there. Okay,
there
no, I'm
go.
fine.
Excellent.
Okay, thank you, Jacob. The United States has not done well for many decades in terms of life expectancy compared to other developed countries. We were towards the bottom for a long time, and now it's worse. We are at the bottom, and life expectancy in the United States has plateaued, and in some groups is actually decreasing. In part, this is due to health disparities, with low-income minorities being at higher risk at every stage of life. This is true in infancy, in childhood, and in the adult years. And there's increasing evidence for multi-generational effects. This is life expectancy at birth by gender and race. And the disparities have decreased a little bit over time, but they're still substantial, with women and Caucasians living considerably longer than African Americans and men. For infant mortality, both African Americans and American Indians are much higher risk than Caucasians and Asians, and in this case, Hispanics. Again, at every stage in life, there are differences. This shows fatal heart attack by age, gender, and race in a cohort study. And again, African Americans are at much higher risk for fatal heart attack, as most other chronic diseases. More recently, COVID case rates in Chicago by zip code at during the April peak showed higher infection case rates in areas that were high poverty, have high infant mortality, elevated lead levels, asthma mortality, and mortality for most other chronic diseases, which show very similar maps on the west and south side of the city. Contributors to health disparities are myriad. They include stress, poverty, decreased access to care, environmental exposures such as lead and air pollution, occupational exposures such as industrial, or during the COVID pandemic, both occupational and non-occupational effects. And these operate as a web of causation. Thus, stress is related to poverty and decreased access to care and environmental exposures, as well as having direct effects. So the example of COVID is an unfortunate but clear example. There's not only increased occupational exposures through being an essential health worker and being in occupations that involve more direct contact with exposed people, but also greater loss of employment, inability of lower income workers to work at home, that is away from other people who might be infected, jobs that require interactions with multiple people, such as grocery stores, lack of cars leading to reliance on public transportation, crowded multi-generational households, lack of adequate medical insurance. Stress can operate both directly and indirectly. It can operate indirectly through through known risk factors such as changes in diet, changes in activity, how in which it's very hard to, and I think Lisa will be addressing this a bit, Dr. Powell, but how can one change one diet when there's not access to reasonably cost healthy foods? And how can one exercise more when it's when one doesn't have time for exercise or space to exercise? So those are indirect effects of stress. But there's an increasing literature that stress also operates directly, biologically, that it can operate through changes in the immune system, which would be important as well in the COVID pandemic. It can operate through changes in the sympathetic nerves, and it can operate through changes in the endocrine system, such as shown here through the hypothalamus in the brain, through the pituitary in the brain, and then the adrenal glands, and in this case, an example into the kidneys. So what are possible intervention strategies? I've listed here the easier and to some extent the less effective, all the way to the more difficult, but probably the more effective. So again, public health education can help. We can suggest that people change their diet, but it may be difficult without an infrastructure to support it. Policy changes may be more effective in that case, having better, more access to healthy foods in the neighborhood. Screening is still very important. It's important in the COVID epidemic. However, it's more difficult to obtain screening if one doesn't have a car or access to a healthcare provider to obtain screening. Similarly, screening for diabetes and high blood pressure involves access to people who do the screening. Again, access to healthcare providers, and not just whether one has insurance, but does one have the time and the transportation and the ability to go to the healthcare provider. Secondary prevention remains important. What we mean by secondary prevention is when one has an issue such as high blood pressure or diabetes, is one in appropriate treatment to decrease the risk of coronary heart disease or stroke. But again, that requires ability to pay for the medication, to see the doctor, to reach the doctor, and find time in your life to go to the doctor, all of which are more difficult if one's low income and lives some distance away. Primary prevention, we all think is better. In COVID, that would mean not being close to someone who's infected. In terms of chronic disease, primary prevention can be exercise or diet. But again, I think we've gone through some of the issues there. Environmental exposures, exposure to pollutants that affect health are higher in low-income minority communities. Within Chicago, we have far more pollution, say, on the southeast side. We have more pollution, again, in the low-income communities. Decreasing those exposures are often political and involve a policy change. Medicare for all would increase access to care, and very highly political, as you know, and probably dependent to some extent on the election next week. It's something that many of us feel would help considerably. And then we come to equalization of resources and educational opportunities and equalization of income. equalization of resources is housing that is less crowded for the COVID epidemic, cause to get to the healthcare provider to obtain screening and medication, resources involving medication, and finally, equalization of income. Hopefully, we'll get to discussions of many of these issues during today's talks. Thank you.
Thank you so much, Vicki. I am the next presenter. As I mentioned just earlier, my name is Lisa Powell. I am a professor and director of health policy administration in the School of Public Health. And let me just get to the slideshow.
How do I get out of here?
So are you seeing my screen now, folks?
No, I think I haven't gotten out.
No, we're seeing Lisa's.
Okay, great, thank you. So I will be talking today about health disparities in sugary beverage consumption and fiscal policy opportunities. And in the case of Cook County, that would actually be lost opportunities. So I want to give a little bit of evidence on the disparities in sugary beverage consumption. And you might be thinking right now, you know, I thought this was a symposium on the environment, but really I want to kind of show and highlight using this sugary beverage consumption and these taxes is about how sort of policies around potentially improving and sustaining health and how that would interact as a potential comorbidity in other exposures that might come from the environment and how that can put you at increased risk for poor health, and also how some of these taxes can be used in the same manner around the environment. So I'll give you an overview of the taxation model, talk about some of the results from when the tax was in place and then it was repealed, and the policy implications. So we've got two briefs that are on our prevention research website that you can look at. And I just want to highlight some of the numbers. And what's particularly interesting is how often, right? So with anything, if someone's not doing something at a harmful extent, then we would not necessarily be concerned. But you can see on average, and this was from some data we had from Cook County, that on average, adults are consuming 2 sugary beverages a day, which is hundreds of calories and a substantial number of grams of sugar. But what's particularly concerning is that the extent to which this is happening at what we kind of think about as frequently, like 2 or more times per day, is particularly high among minority populations. And the difference among females is really stark. You can see that for Hispanic and non-Hispanic Black, it's more than occurring at twice the rate the non-Hispanic white counterparts. Similarly, if you look at the disparity across education, which is a strong measure of socioeconomic status, you can see that adults in Cook County who are more highly educated and hence obviously would have increased income are consuming at lower rates, right? Their exposure to high consumption is much lower, and hence all of the health problems that would be associated as well. And then we've also looked at just added sugar generally from not just sugary beverages, but I will say that sugary beverages contribute on average 50% of added sugar in the American diet, which is why they are targeted good, where one could think about this as a possibility. If we could reduce that, we could really go a long way towards reducing added sugar. So you can see, I won't go in detail here, but you can see similar types of patterns here. And again, particularly the differences by race and socioeconomic status tend to be more prevalent often among females. So why would we think about taxing these goods? So sugary beverages have been shown, that the medical literature has shown that consuming them puts you at greater risk for type 2 diabetes, obesity, and other problems, particularly oral health problems. Obesity in itself is associated with a whole host of other adverse health outcomes, including increased risks for heart problems, hypertension, cancers. And as we have just seen, outcomes with COVID have been particularly worse among populations who have been obese or type 3 or type 4 obesity. So the idea here is thinking about, okay, there's this externality of this cost related to health, and it's actually not just health. There are a lot of poor labor market outcomes as well that are incurred. So the idea is that the tax would increase the price and individuals would reduce their demand. There can also be some signaling effects with taxes, that they send a signal to individuals. And this is kind of where Vicki was getting at. Well, you could try to educate people. We can have public health campaigns, and they're often done in tandem when trying to introduce a tax. But as you're going to see with the Cook County tax, it's almost a natural experiment where we put the tax on. When we take the tax away, had there been any signaling effects that came from education or public health campaigns, you would have expected that consumption may have stayed at a slightly reduced rate after the tax got repealed. I'm going to kind of give you the punchline of where we're going to go, and that is that unfortunately that didn't actually happen. So in this, we're doing an evaluation of taxes actually in 3 different jurisdictions. We did Cook County, we're doing the Oakland tax in Seattle, and looking at a host of things, cross-border shopping, marketing, implementation. But today I'm really just going to focus on Cook County and show you graphically. I'm not going to give you any sort of econometric numbers, but just show you in a nice picture what happened to prices. Did the prices increase during the tax period? And what happened to consumption at the point in time after the tax went in and once the tax came off? So the data that we use for this is that we were able to acquire sales, and we had very extensive coverage from grocery stores, convenience stores, mass merchandise on almost 20,000 UPC codes inside of Cook County. Then we built a 2-mile buffer around the county and had all the stores there so that we could assess cross-border shopping, because at the end of the day, you really want to understand not just if purchases went down in the tax jurisdiction, but if the households crossed the border and purchased additional sugary beverages there, then you wouldn't necessarily have the intended effect that you were looking for to reduce consumption. So we built this 2-mile buffer around, and then we had a comparison group to make sure that we could account for any other secular trends. In St. Louis City and County in Missouri was the comparison. So we had 2 years of pre-tax data, and we had purchased a year of post-tax, and then there was the repeal. So essentially that allowed us to have 16 weeks of the tax weeks, the 4 months that the tax was in place, which was from August 2nd to November 30th of 2017. And then we had 35 weeks of post-repeal. So just to remind folks, because it was a while ago in case you forgot, that this tax was imposed on sugary beverages, but also artificially sweetened beverages at $0.01 per ounce, and it was a retail tax. So this is what happened to prices. So if you can see in the 2 years beforehand, prices per ounce were pretty similar in both Cook County and St. Louis, moved along. The tax went into effect, and essentially the tax was fully passed on to consumers. In fact, it was actually slightly overshifted. So prices went up by just over $0.01 per ounce. And you can see that after the repeal, prices went back down. So the big question is, well, what happened to purchases and hence consumption? And so you can see here as we're going along, so there's differences in absolute values between Cook County and St. Louis, but you can see there's sort of variation, and you see the seasonal variation as well. And then you can see essentially that during that period of time that the tax was in place, consumption fell. And then at the end of that period, when the tax was repealed, consumption relative to St. Louis went back up. So just to give you the numbers overall, which I said I didn't really want to, I didn't want to give you coefficient estimates, but overall in Cook County, purchases went down, volume sold fell by 27%. Accounting for cross-border shopping into that 2-mile buffer area that I mentioned, then the net effect was 22%. So there was still a really significant, that's what you're seeing there, that relative difference, and it's relative to St. Louis. So what are some of the policy implications of this? So first of all, we talked about the fact that there were these racial, ethnic, and socioeconomic disparities in the prevalence of frequent SSB consumption. And folks often think about, or an industry makes the case often, that consumption taxes are regressive. However, from the point of view of health, they actually can be thought of as progressive, because the individuals who are the heaviest consumers will end up changing their behavior and getting a health benefit from that. In addition, lower income individuals tend to actually be more price sensitive. So they will actually change their behavior even more than their higher income counterparts. And hence they will have this net benefit. The one other nice thing about the good of beverages is that there is an alternative, which is low cost, and that's water. It's essentially free. So if we can move people to purchasing, or to not purchasing, but to purchasing reusable water bottles, but using that, and not to actually buy plastic bottled water, but actually use tap or filtered water, then that can really help to offset that. In turn, the revenue from these taxes could be put back in to help low income communities put in a supermarket. So this is something that Vicky got to, like, what are the other constraints that low income and minority neighborhoods are suffering from? Inadequate access to things like supermarkets. We know that's particularly prevalent issue in Cook County. So we can use that tax revenue to filter the money back, even perhaps provide incentives and fiscal incentives like subsidies to healthier items. There have been a number of programs within pilot programs within SNAP that have incentivized subsidies to fruits and vegetables, double up programs that have been at farmers markets. So this is, a particular concern. So now if we think about the fact that the tax was repealed, this is really a lost opportunity. So the 2 years before, we've seen COVID. What might have happened in those 2 years if we had sustained a 22% lower intake of purchases of sugary beverages and the related potential health benefits that could have yielded in terms of lower rates of type 2 diabetes and perhaps net lower intake of calories and body weight. So, sorry. Let me just get back to the last slide. So how does this impact, or how does this relate then to perhaps to some of the environmental externalities and issues that are the theme of this conference? Well, health taxes are similarly used to address environmental externalities when it can be related if there's a health harm or just a general environmental harm. But often those environmental harms, you could think about them as a health tax. So a carbon tax is often considered a health tax in the realm of that. So there's a lot of opportunities to take the same model, which has already been used in the area of pollution. So economists often refer to these taxes as Pigouvian taxes. The common textbook example is often setting the tax equal to the cost of pollution that might, downstream be dumped into a river and kill off fish. And so you can kind of get a measure of this. So, but thinking about this just all around, and there was a nice presentation discussion earlier this morning about how, well, maybe we're moving away from some of the carbon issues, but we have a potentially 10, 15, 20-year transition period. So thinking about gas taxes, right? But one of the issues, again, is taxes are not popular tools and policy tools in the US in particular. They're not very well accepted. And we saw Cook County was an exact example where industry pressure was what resulted in the repeal, right? So again, thinking about there's always going to be pressures. And so this is where the scientists have to sort of think about providing the hard evidence and then working with and translating that evidence so that policymakers can then use that evidence in order to effectuate, really strong, effective policies in place that can change behavior. And again, in the environment, some of that tax revenue could then go to subsidize less harmful forms of energy, whether it be forms of electric or wind or whatever it may be. So I think I'm going to probably stop there. I think I've used my allotted 8 minutes, but I think really this is an example where we've got health problems. After smoking, obesity is the second largest contributor to chronic disease and death in the US. So we've really got to think about that. We saw that with COVID, that having comorbidities really puts people at risk. And it was very stark, and it's continuing to be stark with COVID. And thinking about all of the environmental harms and how individuals can sustain their population health in face of other environmental issues that they may be dealing with, and thinking about similar types of policies that we can use across the spectrum. We use it in tobacco, we use the taxes in for alcohol. They're in more than 40 countries now for sugary beverages. and continuing to use them for environmental health reasons. Thank you. Okay, so thank you for staying with us and continuing. And our next presenter is Dr. Teresa Cordova. She is professor and director of the Great Cities Institute and a faculty member in the College of Urban Planning and Public Affairs. And she will be talking to us about environmental justice and climate change and identifying causes of those and strategies to deal with them. So I'm just going to hand it over to you, Teresa. Thank you.
Thank you, Lisa, and thank you so much to the organizers of this Braun Memorial Symposium. I'm very honored to be a participant and appreciate all of you that are on board with us here on a Friday afternoon. I suspect you've had a busy day and a busy week, so thank you. Okay, so how do I get it to advance? Oh, it did advance, all right. So what I am going to do is talk about the intersection between environmental justice and climate change, making the following points around the disproportionate impacts around communities of color and how those are exacerbated by the very conditions that are increasing the impacts of globalization, and to look at that inevitable, that inextricable link, and then to suggest a range of values and strategies that can help us to deal not only with the issues around environmental racism, but around climate catastrophe itself. So the first thing I do when I think about environmental justice is I go back to my own roots and in thinking about some of, well, they may precede it, but my organizing roots anyway, with respect to thinking about some of these issues, which is back to the early days of the environmental justice movement, which we often think about as beginning with that 1987 report from the United Church of Christ on toxic waste and race, followed by some organizing that was done in Warren County, North Carolina, South North Carolina, and then the 1991 First National People of Color Summit in DC. So some of these photos are taken from that summit, and what you immediately see from the photos that it was very much a cross-cultural effort among various peoples of color, Black, Indigenous, Mexican, Puerto Rican, and Asian, and that the movement itself was very much characterized by this cross-cultural, cross-regional, urban and rural, and all across the country, and then eventually became more international as well. One of the things that came out of that People of Color Summit in 1991 was a series of principles in environmental justice, 17 to be exact. And one of the things that I think is always really important to do whenever we're talking about policy and the impacts of policy is to go back and think about what are the various underlying values that inform our approaches to policy. And so I'm very much very respectful of legacies that come from efforts where people put together principles. And so I wanted to remind us of the importance of this people of color gathering and the principles that emerged out of that. And I'm just highlighting 3 of them, though there were 17, but one of them, of course, reminds us always about the connection to and the affirmation of the sacredness of Mother Earth. And what a novel idea, right? That we should value being free of ecological destruction. Not having honored that all these years is part of what has gotten us to this point of climate catastrophe. And then this idea that we should be thinking much more, right, about the balance and the responsible uses of land and renewable sources. And then again, this idea of the planet for humans and for other living things. And then environmental justice mandates, okay, so, all right, for some reason, oh, there it goes. The environmental justice, an 8th principle, again, I'm just highlighting 3, affirms the right of all workers to a safe and healthy work environment. And this, because one of the things I'm going to talk about here in a little bit is this sort of forced dichotomy that somehow we need to be choosing as a society between employment and environment. and yet the affirmation of the rights of workers to work without being contaminated is an important right. Again, highlighting the idea of environmental racism, which is what gave rise to the environmental justice movement of the late 80s and 90s, and which continues today. That photograph is taken from Cancer Alley, which is a good part of Louisiana. So not only is in the area that's called Cancer Alley from Baton Rouge on down, and you can get a feel there for the amount of contamination, but you also see that it's along a river. And so there was an impact on the river itself. But one of the things that we have learned, that we learned not only from that initial report from United Church of Christ, but a subsequent report from 20 years later, but research that has continued, which is that race is still the most important predictor of waste in industrial facilities, citing that toxic industrial activity is still concentrated in communities of color, and that communities of color still these dumping grounds for toxic waste. And so we're dealing with not only particular individual negative impacts, but the synergistic impact, right, of combined chemicals, which is a difficult one to measure, but also the cumulative impacts. And finally, this condition where environmental laws and regulations, where they exist, are not equally enforced. And so the notion, again, coming out of the movement of unequal protection. And so that I want to, again, just to make the point that the very conditions that give rise to this environmental racism and these conditions in communities of color are the kinds of activities with the various impacts that are giving rise to our climate catastrophe. So that addressing both is very much in our collective interest. And so I think that's one of the main points that I want to make, right? That there is that link, that addressing environmental racism helps us to address the impending, and in some places already, climate catastrophe. So what about in Chicago? So both of these maps were created by the Chicago Environmental Justice Network. And so those very points that I was making more generally about the targeted and concentrated location of some of these activities, it is true, of course, I shouldn't say of course, but it is true also, it shouldn't be of course, but it is true in Chicago. And so what we have are concentrations both in the southeast side of Chicago, which is where both of these, well, the one map is, but also in the southwest side. And again, areas that are predominantly homes to people of color, Black and Latino especially. And so besides the industrial activity itself, one of the things that I think is important also to highlight that folks from El Vejo, which I know, Vicki, you interface with them quite a bit, folks from El Vejo and folks from the southeast side are calling attention for us to the issues around the trucking, distribution, and logistics sites, and what their impact is. So aside, I mean, what you have in these areas, for example, is the incredible amount of leftover industrial toxicity from our heavy days of industrial activity. And so one of the things that we are still continuing to deal with is the initial contamination that went back for decades and decades. But then when many of these companies left, they left without any cleanup. And so many of these sites remain contaminated. And then similarly, as for example, we moved out of northwest parts or the northern parts of the city industrial activity, it's being moved into the southeast side and being concentrated there. And there are still people who live around these areas who have to deal with the smells, the seepage, and the continued impacts in the environment with increased truck traffic, for example. So this is some of what we face, what people in those neighborhoods face, but it's a situation that we collectively in Chicago are facing. This is a map similar to the previous one with respect to identifying the location for the trucking, distribution, and logistics. But this one is in South Lawndale. This map, I believe, might have been produced also by the Chicago Environmental Justice Network, but it might have been produced by Alvejo. In any case, I've borrowed these maps to share with you all. But again, showing that concentration of that activity. So if we're looking at trucking, distribution, and logistics, for example, which is very important to Chicago's economy, and we saw that especially during the COVID, and I think we can anticipate that it's going to become increasingly more important. One of the things that we must note, we can note by looking at this map, is how concentrated it is. So imagine what that means for people living nearby, and that therefore probably wasn't a shock to the people living in Little Village that during a respiratory pandemic, where there are such conditions of intense truck traffic and pollution from some of these activities, that there would also be high, and also areas in industries where Vicki was talking earlier about the household size and where they work and an inability to stay home based on where they work. But all of those issues combined led to Little Village, the South Lawndale area being the area with the highest rates of cases of COVID. Again, maps are worth 1,000 words, and sometimes so are photos. And so one of the things that we see from this photo, right, is this rail yard, reminding us how important rail is not only to this logistics industry, but how important Chicago is to logistics in the entire country, where we have 5 out of 6 of the major railroads that operate in and out of Chicago, and where we have and which are so key to this movement of freight in and out of the region, and then from there it gets distributed. So we are very key in the city of Chicago and in the region to the nation's economy with respect to trucking, distribution, and logistics. But you can also see that there are houses in these areas. So again, what I'm trying to point out here is the juxtaposition of the concentration of these activities in these nearby neighborhoods, and they are not without their impacts to health. So we see we've got 19 intermodal ports in Chicago. This is a slide that I also borrowed from Alvejo, but pointing out that 6 of 7 Class 1 railroads meet in this area, and that we have the second most volume in all the country after the ports of LA and Long Beach. Pointing again to the importance of this in our region, but again also to the impacts of people who live in surrounding neighborhoods. So again, these are the very industrial activities that are polluting communities of color, are contributing to the pending climate change, given the sort of type of industries that they are, with the industrial activity, with the intense truck traffic, for example, and the emitting pollution, and then in places like the Southeast side, the other kinds of intense industrial activities, including things like coke and other metals industries. So what are some of the implications of that? Well, with respect to land use planning, there hasn't been to the extent that it's needed to be, the coordinated planning with respect to the locational logistics activities, for example. So we need to be asking, why do we locate economic activity where we do? And especially when we think about how this relates to communities of color. And given this issue around environmental justice and the health impacts of environmental racism, how does industry get prioritized over the health of communities? What about accountability? Why is there a lack of accountability and oversight to the industry when they are there? And why are they able to operate with impunity and not be made accountable on the amount of pollution that they emit? Why were former industrial sites allowed to be abandoned without any cleanup? And why is the economic system pitted against the health of communities? Why is the economy pitted against the environment? And I think these are all really important questions that we need to ask, because ultimately our ability to address these issues really have more to do with with politics and the economic pressures of those who most benefit economically from these activities, their pressures on the politics, making it more difficult not only to address the environmental injustices in these communities, but also, again, the global climate catastrophe that we face if we don't will continue to face if we don't address these issues. There are, however, a range of alternative economic values and strategies that as the movement has developed over decades. Not only have they been engaged in fighting instances, trying to get the hazardous waste sites closed, trying to get the monitoring into place, trying to deal with the health impacts and so on. They've also emerged in the movement to address a number of values and strategies. And so what I suggest then, given that this is something that it is being put forward by people who are most directly affected by this, not only these kinds of activities, but also other kinds of impacts that come from climate change, like the forced migration, for example, that we're seeing, for example, coming out of Central America. So we must ask them, what can we learn from today's environmental justice movement? So again, here in Chicago, there is the Chicago Environmental Justice Network that pulls together a number of these groups who are engaging in these issues. The Just Transition Alliance, which is a national alliance, and then the Climate Justice Alliance. So one of the things, so some of the ideas we get from them is this idea of a just transition. And the notion of just transition is essentially, how do we move from an extractive economy to a regenerative economy? Not an easy thing to do in light of the politics and economics to which I just referred, but also especially because, well, part of what the urgency of why we need to is because literally our ability to remain as humans on this planet depends on it as the clock is ticking. And so you can see, for example, in this kind of world view around the extractive economy, what that has meant in terms of the dig, burn, and dump mentality with respect to our resources, the militarism to enforce some of these policies, the nature, the ways in which labor itself gets exploited through this process, and especially, right, ultimately this transference of wealth, not only from individuals and from the work of individuals, but also from the state itself, right? The way we're moving money. So that while the rest of us are becoming more and more fearful and impacted by climate change, there are those who are making more and more money from it. So that's sort of, if we think more about the extractive economy, and clearly in contrast to some of the values related to the sacredness of Mother Earth. And yet there are some ways that, and it's not going to be overnight. We didn't get here overnight, so we're not going to get the solutions overnight. However, there is, as I mentioned earlier, there is this incredible urgency because we do near the point of no return with respect to some of these changes. So part of it has to do with how do we shift our economy, how do we shift our the way we obtain our energy. What does this mean for democratizing wealth, the workplace? What does it mean for ecological restoration? So the idea of a regenerative economy is one that's built on ecological and social well-being, cooperation. My goodness, what a novel idea. If only we could do that, we might get out of this pandemic sooner. But something else so important, right, is the values of caring and sacredness. You know, and again, sort of drawing upon my own indigenous roots, this idea, right, of sacredness of our place, of our Mother Earth, you know, is something that's important. And then the idea that our resources are not ones to be dug, burned, and dumped, but one to be regenerated. And so it does require a value shift. It does require economic shift, political shift, none of which is easy, but all of which is urgent. And so we do need comprehensive land use planning so that we can think about locations of industrial activities and intermodal logistics sites, how we do that. We do need measurements to monitor these operations. Sometimes we don't even have the measurements, or we have them, but we don't put them in place. And we can certainly say that about a lot of the sites throughout the southeast side, for example. We do need regulations and policies that limit the pollution, the concentration of putting economic activities in communities of color. And then again, the just transition to a regenerative economy where people and planet are not poisoned, allowing us to be able to remain as humans on this earth. Bringing back some of and reconsidering the principles of environmental justice and understanding, as I've said now several times, our ability as humans to live on this planet is literally what is at stake. And so one of the things that we can, one very small step, and aside from all these others, and this is just an example of something we've done at Great Cities Institute, is working with neighborhood folks to tackle some of these difficult challenges by facilitating a community-based planning process to identify issues and visions and address some of the contamination in that part of our city. So with that, I'll wrap up and look forward to our conversation among us. Thank you.
Thank you, Teresa. We appreciate that. So our final presenter is Dr. Sam Dorevitch he is an associate professor in environmental and occupational health sciences in the School of Public Health. And Sam will be speaking to us highlighting CDC's framework for climate change and talking about policy initiatives that can help improve preparedness. So Sam, do you want to share your screen and hand it over to you?
Hello, everybody. My name is Sam Dorevitch, and I'm going to be speaking about climate change, public health disparities between rural and urban areas, and work that we're doing at the UIC School of Public Health to address this major challenge. I'd like to thank the organizers and Professor Hammond in particular for inviting me to be part of this symposium. The Centers for Disease Control, the CDC, has established something called the Climate Ready Cities and States Initiative to help jurisdictions around the United States be ready for the health consequences of climate change. This is not a climate change mitigation initiative. It's not about reducing greenhouse gases, but it is about trying to manage what is going to happen, what has already begun happening on the part of particularly local health departments, but also state health departments. And the Climate Ready Cities and States Initiative developed something called the BRACE framework, the Building Resilience Against Climate Effects, which is a structured process that states and cities and county health departments can use. So the UIC School of Public Health is the bona fide agent of the Illinois Department of Public Health for this project. So unlike nearly all other cities and states that have received BRACE funding, we are doing it on behalf of the health department. And our website, www.braceillinois.uic.edu, has reports and all kinds of information for the public, as well as public health practitioners about climate change, its health consequences, and things that could be done so that we are not unprepared. Nobody wants to be unprepared, whatever your politics about climate change. So a fundamental principle of climate change impact on health is that the health effects of climate change are location specific and pathway dependent. In other words, it isn't easy to say these are the effects of climate change. It depends on where, and it depends on, and it's driven by processes, pathways. So location specific clearly states that, or means that, say somebody on the northeast coast of the United States is at risk for climate related sea level rise, whereas in the Gulf Coast, sea level rise will also occur, is already occurring, but also hurricanes and the health consequences of hurricanes will be expected there. Whereas in other parts of the country, drought is expected, and in other parts, flooding and heat waves. And then pathway dependent. There are physical, chemical, biological processes that drive these health effects, so that if there is a certain mosquito or tick that carries disease, and it is now able to extend its geographic range into new areas, or to reproduce more efficiently and have a longer season when the temperature and the precipitation are right for it to infect people. In such an area, we would expect vector-borne and tick-borne, vector-borne diseases from mosquitoes and ticks. Up to a certain point, place matters. There are parts of the country that have seen relatively little effects of climate change so far. And then there are others, especially Alaska, and in general, the Arctic region has seen major effects of climate change much more rapidly than other parts of the world. So even though some people say this ship can't be sinking, I don't see those climate changes or the health effects of those climate changes. It's just a matter of time before the whole ship goes down. So in Illinois, when people think about heat waves as a consequence of climate change, that heat waves, of course, occurred decades ago as well, but the probability of heat waves occurring and the intensity, duration, and impacts of heat waves increases because of climate change. And this is a mass grave in 1995, where victims of the Chicago heat wave who had no identified family or resources were buried. The Sun-Times showed a picture of the Cook County morgue, medical examiner's office, with refrigerator trucks in front because the number of bodies was more than they could handle. The heat toll could hit 300, it said on July 17th, 1995, but it exceeded 700 at the end. But urban areas like Chicago are not the most at risk for heat wave of health effects. What you see here is a paper that we published that looked at rates of hospitalization for heat wave in Illinois. And the colors, the pink, orange, green, blue, etc., are about urbanization. With the most rural, the most thinly populated areas in blue and purple. And the size of the green dots is the rate of hospitalization per 100,000 people. So it's not the number of people who are hospitalized for heat-related illness. No doubt the numbers are biggest in the Chicago area, but as a percent of the population, rural areas are at greater risk for having heat-related illness requiring hospitalization. So this should make us rethink some of our ideas about disparities between urban and rural areas, that there's substantial risk in both, but from a hospitalization per 100,000, heat-related illness is a bigger threat to public health in rural areas. Flooding is something that in this symposium, people have talked about from the standpoint of the metropolitan Chicago area. But when you look at the map on the left showing federal declarations of disaster for flooding in Illinois, it is not only something that we see occurring in Cook County on the upper right, but also in many rural counties along the river systems, the Mississippi and the Illinois River and some of the other river systems in the state. So again, rural areas are at risk. It turns out that riverine flooding, floods where rivers overflow their banks due to heavy precipitation and snow melt in that area or upstream is a real challenge in Illinois. And not only is it a challenge and a threat to public health, but it's a threat to healthcare facilities. When Hurricane Sandy or Superstorm Sandy hit the New York area, people were unable to get medicines at pharmacies because they were closed because of flooding. They were unable to go to dialysis centers and get dialyzed. And so people with chronic kidney disease ended up, and people who needed to get insulin came to hospitals and emergency rooms, sort of the more resilient structures. And we evaluated floodplains, 1996 floodplains, a 1 in 100 year flood or a 1% probability per year. And we found that there are many healthcare facilities in Illinois that are currently in floodplains. And as floodplains change over time because of heavier precipitation or because of changes in land use, more facilities will become vulnerable. So this is a website that we developed for local health departments and emergency managers, people who do planning for emergencies, so that they could plan for flooding, knowing that certain healthcare facilities in their areas are in floodplains and and the likelihood of flooding in these areas is growing over time. So they should use that information in planning. Another initiative that we've deployed in the BRACE project in Illinois is trying to help health departments in rural parts of the state address climate change. Because health departments generally, and certainly in rural areas, thank you, are in need of resources, that they don't have the funding to allocate staff time to address climate change. We and recipients of Climate Ready City and States Initiative, CDC funding in other states, independently came up with an idea of channeling some of our funding to local health departments so that they could begin addressing climate change issues and to normalize discussions about climate change as a routine part of health conversations and a routine part of health planning and preparedness is something that we're starting to see as a result of those funding, that funding. Clearly, funding should be sustained, especially if it's going to grow what's already begun, and federal funding for local health departments to address climate change is definitely needed. Those are the end of my comments. Thank you for your attention. And again, thank you for the Braun Symposium organizers for the invitation.
Thank you so much, Sam. Yeah, the mini grants are such a great idea. So we don't have, well, we are sort of at the end. So I think what we might do is, I mean, we all probably kind of went a little bit over on our presentations, but it was just, great to hear everything. There was just so much there. So I think perhaps folks wanted to reach out with, by email. There was some great chat. You can kind of see some of the comments. And I did ask for questions in the chat box. There are not too many new ones now, just some comments. Some really great comments throughout. So I think at this point, I'd like to hand it over to Celeste, who will be giving the final, Celeste Hammond, Professor of Law at the John Marshall UIC Law School. And just to thank you so much, Celeste, for bringing us all together in this panel and for organizing it. We really appreciate it. And you have the final word. Sam, could you stop sharing your screen?
Oh, Lisa, I really appreciate this panel.
Hello?
Professor, you might be frozen.
for the screen. I got no problem with that because I think it's, I don't want to lose everyone as I think and sharing. And, you know, before today, Lisa and of course Sam was my inspiration for the Braun. He was at the very good. The conference has been an engaging learning experience for all of us. And it did confirm my dream of learning about climate change and sustainability beyond the law silo. I think for showing us how future collaborations among makers.
Professor Hammond, it sounds like we lost you altogether.
I think we might have. And I think, you know, if we heard what she was saying at the beginning, the opening of this conference, and I think really trying to talk about the fact of all these different disciplines coming together in the topic of environmental health and policy. And really, I think part of her goal, which I think has sort of happened, is to show that so many of us from different areas, and I was always concerned, like, how am I going to fit into this? And as I was sort of thinking about parallels, saw that there really are a number of parallels. And I think the idea to really enhance collaboration across the university, both across the faculty, but with graduate students, undergraduate students. And I think that this conference has done a really great job of pulling together the faculty and providing a space to talk about important topics. And I think in this day and age, right now in the middle of the pandemic, these topics could not be more timely. So I think on behalf of Celeste, I would just think she would want to say, let's continue the conversation. We may have kind of run out in this session, but I think that's also reflective of the fact that we just have a lot to talk about, right? And so we all had, we didn't have enough time. So on behalf of Celeste, I would just like to thank all the panelists and the participants, attendees for joining. And thank you, Jacob, for all your technical support. We're all still learning to operate in this environment, and it's not always easy, especially when sometimes our own internet or Wi-Fi wanes in and out. So thank you all for joining, and we look forward to continuing this conversation.
Thank you so much, Lisa.
Thanks,
everybody.
Lisa.
Thanks, everybody. Take care. Keep safe.